The minority in Parliament says it will push for a parliamentary probe into the various abandoned health facilities across the country. Ranking member on the Select Committee on Health, Kwabna Mintakando, argues that loans worth over millions of dollars procured to construct the facilities are not being put to the intended use. The Minority Caucus on the Select Committee on Health has been touring a number of these facilities and was at the Yilo Krobo District Hospital on Tuesday. The 120-bed health facility, which was completed in January this year and handed over to government, is yet to be put to its intended use, despite calls on the health minister to ensure the facility starts working. Here's Chrissy Parker-Wilson's report.
This is the Yilo Krobo District Hospital. We are told that this facility was completed and handed over to government January this year or early this year. Well, the assurances was that the facility will see some operationalization by August this year.
The ministry has applied for financial clearance for recruitment of support staff. And when this is approved, the assuming at this hospital will be allocated with the requisite support staff to enable operations to commence. Meanwhile, clinical staff have been identified and will soon be posted to the facility. We are anticipating that the hospital will be commissioned before the end of August 2021.
Well, that hasn't happened. The Member of Parliament for the area is unhappy with the situation. He fears this project would also add up to the number of abandoned projects across the country. He's asking government and the health minister to quickly ensure that this project is put to use.
So I had the opportunity to file a question to ask the minister to come and open the hospital. And he said the hospital was going to be open soon. I think that was in June. Up to today, the place is lying idle. Our people don't have access to healthcare because the hospital is very small. It's a health center. And a lot of people are coming from all villages and they cannot get access to the place. So I'm taking the opportunity to call on the government that this hospital must be open soon, must be open now for our people to get healthcare. If you keep it like this, then we are actually causing financial loss to the state because all the money is here, all the investment is here, and our people do not have access to healthcare.
Ranking member on the health committee who toured the project to see that indeed is a completed facility which reached its call to government, and also indicated that the minority will ensure that government really complete all the projects that have been abandoned.
My understanding was that it should have been in operation by now. So when I was coming, I thought I was going to see medical doctors and nurses in this facility. Unfortunately, it's been handed over technically to the ministry and they're still idling. If you're not very careful, you see the grasses have started growing weedy, and very soon the facilities will also start deteriorating. So I think that I will add to the appeal from the MP that government must immediately operationalize this facility for the people in the area to get a full benefit of the facility.
For Joy News, I'm reporting from the Yilo Krobo District Hospital.
Right. On phone by Dr. Gabriel Benanko, who's advisor to the Coalition of NGOs in Health. Good morning to you, Dr. Benanko. So I'm sure you have been paying attention to the tour by the minority. How widespread is the problem?
Yeah, thank you, and good morning, Ghana. Yeah, this is not a new thing. Over the last 4 years, we've been talking about it, abandoned health projects, uncompleted health projects, unupgraded health facilities, and new facilities emerging. So they are actually an issue that government and partners need to look at it seriously.
What has been your understanding of why these projects have been left idle?
Well, it's only God who knows. We have articulated this with the Minister of Health. We have talked to all political parties in the 2020 election for them to do something about it. We have tried to play a watchdog role by by naming and shaming some personnel who are managing or who are supposed to ensure that health facilities are properly put to use. But we still don't understand why we still have more health facilities that need to be upgraded, that need to be used, and that need to be completed.
Now, for now, let's focus on the ones that have been completed or that can be worked on to be finished. When you engage the politicians or the leaders, what is it that they're telling you is the difficulty?
Okay, let me give you some few examples,
Right.
and then we can all appreciate. You knew that you are aware. We have done this with joy severally when the University of Ghana Medical Health Center was claimed that it was not ready for use.
Yeah.
After we have talked more about it when I was the national chair for the coalition, and Joy also came out with a lot of publicity. Later on, the stakeholders, the health minister and his team decided to use it. Just after they started using it, COVID came, and now the place became very important for national response on COVID. So that tells you one critical thing that advocacy has done for the benefit of Ghanaians across the country.
Right, so looking at the UGMC issue, one of the concerns that came up was they had to get the adequate staff, and they also had to install a standby generator and a number of things. Are these some of the excuses that you get?
Yes, my brother. These are hardcore facts that those facilities, to the best of my knowledge, right from 2012, I was monitoring every health facility being put or being completed or being halfway, 90% complete. And I say this everywhere. The University of Ghana Medical Center was ready to be used. You cannot, any health expert will tell you, you cannot finish a health facility completely before you start using it. You always have to start using it while you put in place other things. And when you go to every facility, especially a hospital, you will continue to upgrade it based on the data you are getting in serving people. That informs you on how you can upgrade it. For example, you start with OPD, with emergency, but you get data from OPD that tells you that you need to upgrade it to some specialized services that you need to put in place. And then you continue to upgrade it until when the facility is much more resilient. So every health facility in Ghana, fortunately, the Ministry of Health, Ghana Health Service, they have a standard of what they call hospital, specialized health center, district hospital, polyclinic, chip compound. They have a standard. So once you are putting up a health facility, it's already approved that it's supposed to be like this. And therefore, you have to work to ensure that it's being put to use to respond to the reasons why it was put to use. It was put in the plan for the construction. And then we have serious challenges in Ghana where we have health facilities, they are not completed. You have health facilities, they are not used to the fullest. You have health facilities that nobody cares about them. Sometimes we make political games out of it, but health issues cannot be compromised. I keep on saying this over the last 6 years as I was the national chair. You cannot compromise health. You can do for other sectors like education, agriculture, but when you compromise health standards, one life is lost, you cannot get it back. So it's high time all stakeholders, especially the Ministry of Health, take a serious response to the public cry that let's upgrade health facilities that are underutilized. Let's complete health facilities that are not completed. Let's use those that are completed, but we have not utilized them well. And this issue will be a plus to government and all state protocols. Health issue cannot be compromised.
It's true, except I'm sure that we would hear that it has to also do with finance, and we probably don't have all the funds to get to do these things, all of them.
Israel, if you like, let me take you around the country at the district level. You see health service being offered under trees. So if you have a structure that you are already put in place, let me give you a typical example. In Doma, about 3 years ago, we went there, a community that was supposed to be earmarked and have a structure for cheap compound. They were using trees under trees to offer ANC, child welfare services. The coalition received funding and we went to Doma in that community to put up a structure there. Go and see today. The place has been upgraded. The place is being used as a proper flesh center that is receiving more people who are seeking health services. So when you have a facility like that, and the NGOs are talking about it, it's not because we just want to talk. It's because we know that it is the best alternative for now. If you put to use, it can serve a lot of people. And so, with all due respect, politicians need to really sit up to ensure that health facilities are responding to the needs of the people.
All right.
You are aware of the Kumayu issue we raised in 2019 and 2020.
All right. What was the issue with that?
A facility which is supposed to serve over 300,000 people and is not completed. The government has talked about it severally and it's still not completed. Stakeholder has been told it will be completed and it's not completed. And people are running over 100 kilometers to seek for health services. You can imagine the cost and the depressions that people face to seek health services. That one alone is also a medical condition. You can imagine people who are sitting close to a facility that is constructed and who is supposed to serve a purpose over the last 4 years and is not being put to use. You can imagine how stakeholders feel about it.
All right.
So it's a serious matter that without any hesitation, the leadership in the health sector must wake up and take a serious look at the health facilities we have in this country and find a way of collaborating with development partners, civil society, the community leaders, the media, to make sure that they are properly projected in a positive way, to make sure that they are properly put to use to respond to the health needs of the people. That is a plus. And everybody would love to see that within the next, the radius of 50 kilometers, they have a district hospital that they can rely on. They have a polyclinic that they can rely on. And they have a referral facility at the regional level they can rely on. We need to really act as a country, and we need to support government to realize that there's the need for proactiveness in managing and using health facilities in Ghana.
All right, thank you very much, Dr. Benanku. Dr. Gabriel Benanku is advisor to Coalition of NGOs in Health.